Hello and welcome to our channel. Today, we're tackling a topic that affects millions of people worldwide: heart failure. Maybe you've heard the term before, but what does it really mean? And more importantly, how is it managed today? What exactly is heart failure? It's a clinical syndrome where the heart can't pump or fill properly to meet the body's need, and it is caused by a structural or functional problem with the heart. Now let's talk about classification. Heart failure with reduced ejection fraction. This is when the left ventricle, the heart's main pumping chamber, is weak, with an ejection fraction of 40% or less. Heart failure with mildly reduced ejection fraction. This is a newer category for an ejection fraction between 41% and 49%. And heart failure with preserved ejection fraction. Here, the pumping function seems normal, 50% or more, but the heart muscle is stiff and doesn't relax properly to fill with blood. So what causes the heart to fail? We can use mnemonic chips to memorize the causes. C. Coronary artery disease. H. Hypertension. I. Idiopathic or infiltrative diseases. P. Post-viral myocarditis. S. Structural issues like valve disease. To this list, the guidelines also emphasize other causes like cardiomyopathies, toxins such as excessive alcohol, and persistent arrhythmias. When the heart is under stress, the body tries to compensate. The heart muscle can get bigger, that's hypertrophy, and the chambers can stretch out, which is dilation. But the body also kicks two major systems into overdrive. The sympathetic nervous system. This is your fight or flight response. It increases heart rate and squeezes blood vessels. The renin-angiotensin-aldosterone system. This system makes the body hold on to salt and water, which increases blood volume and pressure. Initially, these are rescue measures, but over time, they actually make the heart work even harder and contribute to the downward spiral of heart failure. Let's know, how do we diagnose heart failure? The path is very clear. If a doctor suspects heart failure, for example, a patient with history of coronary artery disease developed fatigability, swelling, and shortness of breath, they'll start with a simple blood test for BNP. BNP is a hormone the heart releases when it's under pressure. If the BNP level is high, the next step is an echocardiogram. The echo is key because it tells us the ejection fraction and helps classify the heart failure into one of those three groups we talked about. Now for the most important part. Treatment. This is where things have really evolved. We have 4 pillars of treatment. An ARNI, which is the combination of sacubitril valsartan. This is now preferred over a standard ACE inhibitor for most patients. An evidence-based beta blocker. A mineralocorticoid receptor antagonist, MRA, like spironolactone. And the 4th pillar, an SGLT2 inhibitor, like dapagliflozin or empagliflozin. This is a game changer. SGLT2 inhibitors were originally diabetes drugs, but they are so effective at protecting the heart that they are now recommended for all heart failure patients with reduced ejection fraction, even those without diabetes. And the big news from the 2023 update guidelines is that SGLT2 inhibitors are now also recommended for patients with HFMREF and HFpEF to help keep them out of the hospital. You might ask, what could be causes a sudden worsening or decompensation of heart failure? You can use mnemonic of failure in order to not forget. Forgot medications. A. Arrhythmia. I. Ischemia or infarction. L. Lifestyle factors like too much salt. U. Uncontrolled hypertension. R. Renal failure. E. Embolism. This highlights just how important lifestyle and ongoing management are. The general measures like restricting salt, managing weight, avoiding certain drugs, and getting vaccinated against the flu and pneumonia are all part of a comprehensive care. Thanks for watching. Did this video help clear things up for you? Let me know by hitting that like button.